What are our future plans? Switching to a universal public health care, known as a single payer. What is single payer? Under a single payer system, all Americans would be covered for all medically necessary services, including doctor, hospital, preventive, long-term care, medical health, reproductive health care, dental, vision, prescription drug, and medical supply costs. Will it work? Whenever wealthy people jump the line for additional care, others suffer from extended waits and wait lists. If the wealthy are forced to rely on the same health system as the poor, they will use their political power to ensure that the health system is well funded. However, programs built in opposing favor for the poor will in due course become significantly inferior programs. In contrast to a single-payer system, allowing the development of a parallel private system for the wealthy means the creation of a permanent lobby for underfunding public care. Such underfunding increases the demand for private care. Also, businesses can buy additional coverage, but it would only go towards things that are not covered by the national plan. Examples: private sessions and orthodontia. However, a single payer will support a wide-range benefit package for the single-payer program that would eliminate the need and most demand for supplemental coverage. On another note, alternative care that is proven in clinical trials to be effective will be covered. For example, spinal manipulation for some lower back conditions will be covered. Also, antioxidant vitamins would be covered for people with macular degeneration, but not for the general public where they appear to be harmful. New kinds of treatments will be added to the benefit package over time as they shown to be effective, including alternative treatments.
The cost of health care is increasing for many reasons. The baby boomers, which are a large portion of the population, are getting older and will require more medical care as they age. This increase in healthcare services will make costs go up. As the dollar loses value to inflation, healthcare providers will raise their prices to compensate. Inflation is increasing faster than income, driving up the costs of medical care. Operating costs at U.S. hospitals are 4 times the average for industrialized nations. More serious illnesses, high overhead costs, and free care for the uninsured all contribute to the high operating costs. Americans use less pharmaceuticals than many other nations. However, we spend $57 billion more on new drugs yearly than most countries. This is due to new drugs being available in the U.S. before other countries, and because manufacturers are allowed to charge an average of 60 to 70% more for brand name prescription drugs. Medicare and Medicaid were created by the government in 1965 to help provide the elderly and needy with medical care. Almost immediately after their passage, millions signed up for the programs and the numbers continue to grow. Although many benefited, Medicare and Medicaid also opened the door to political abuse of the healthcare system, which has played a part in the increase in costs. Additionally, many opted to use these programs as an alternative to buying health insurance, further raising healthcare costs. American doctors make about twice as much as foreign doctors. A big factor for this is that American doctors charge based on the number of patients seen and procedures performed. Private doctors have substantial investments in the labs and outpatient clinics they use for medical services. Because they want to get the maximum return on their investments, they will run more tests and perform more procedures than a larger hospital would. Many plans exist to reduce the high costs of healthcare. By offering several health plans instead of a universal one, an employee could choose the one that suited his or her needs best, saving both the company and employee money. Eliminating government subsidies and involvement, and allowing healthcare providers to compete would bring prices down to affordable levels. A plan used by several states to fund certain types of mental health care reduced insurance premiums, as insurers were able to eliminate those parts of their policy and reduce rates. If this plan was more widespread, healthcare costs would be reduced. Flexible spending accounts, or FSAs, are tax-free dollars for out-of-pocket medical expenses, such as glasses or small, predictable medical bills. FSAs would be used in addition to an insurance plan whose premiums would be lower because things covered by FSAs could be eliminated from coverage. Merging smaller hospitals, those with less patients, or those very close to each other, would bring down costs by eliminating duplicate services. However, this could potentially be offset by rising prices due to lack of competition. Universal health care can be funded in several ways. A single-payer system works where one party, usually the government, pays for everyone's health care. The government collects taxes and uses the money to pay the different healthcare providers, making it the only or single payer. A hybrid healthcare system works in which the government pays for a portion of the medical bill with tax revenue, and the patient pays for the rest. A private universal healthcare system works by deregulating the healthcare industry, allowing the free market to set healthcare prices, and making it mandatory that everyone buy health insurance. Costs would be minimized and innovation and efficiency would be encouraged. Those unable to afford insurance would be given government assistance.
Some advantages of a single-payer healthcare system are that everyone would be insured. In 2007, Commonwealth Fund Biennial Health Insurance put out a survey and found that nearly 50 million Americans did not have health insurance, while another 25 million were underinsured. People who are underinsured means that they struggle to pay their health care bills. With a single-payer system, they wouldn't have to worry about struggling to pay those costs. In a single-payer system, the one entity, a government-run organization, would collect all healthcare fees and pay out all healthcare costs. Another advantage is hospital billing would be eliminated because the government would be billed instead of the individuals. Instead, hospitals would receive an annual lump sum payment from the government to cover operating expenses, called a global budget. A separate budget would cover such expenses as hospital expansion, the purchase of technology, marketing, etc. Some disadvantages would be limiting profit for new drugs and treatments. If the federal government became the only payer, limiting potential profit, companies would be less likely to invest huge sums necessary to develop new drugs and treatments. One of the major issues, though, with single-payer system is that the time it would take to implement. I will now talk about the Japan healthcare system. Japan has a single-payer healthcare system. It has the lowest per capita cost among the advanced nations in the world. Patients are freely to choose their providers, and doctors are also freely to choose procedures, tests, and medications for their patients. Administrative costs are the overhead costs of healthcare, from billing to building maintenance, essentially everything not related to patient care in the system. In the U.S., administrative costs includes the cost of managing public programs such as Medicaid and Medicare, as well as the administrative costs of the private healthcare insurance industry. In this graph, you'll see what percentage of GDP is spent on healthcare. In this graph, you'll see that the U.S. has the largest administration costs. It almost doubles Japan. The United Kingdom also has a single-payer tax system, and it's financed by the National Health Association. The government sets the budget for the NHS on a 3-year cycle. To control utilization and costs, the government sets a capped overall budget for primary care trusts. NHS trusts and PCTs are expected to achieve financial balance each year. The centralized administrative system tends to result in lower overhead costs. Other mechanisms that contribute to improved value for money include arrangements for the systematic appraisal of new technologies through the National Institute for Health and Clinical Excellence. If you take a look at this graph, you'll see how citizens view their healthcare systems in their country. Almost all systems have a high number of citizens who think their healthcare system needs significant changes. Although only the U.S. has a 34% rate of people desiring it to be completely rebuilt, almost twice that of any other country. For the most part, the belief that their medical systems provide high quality, expert care is similar across these countries.
Carrying the costs. For every uninsured patient treated, the costs are carried by the rest of the citizens. Costs amount to approximately 17% higher rates than insurance costs, which means $445 for each individual who pays for insurance. Because of these costs, many businesses have stopped offering healthcare benefits. Low-income workers cannot afford to pay for health coverage. The report shows that the cost of uninsured averages $35 billion a year. Healthcare costs have continued to rise. When unable to pay, the government are the primary source of funding. This only amounts to less than 6% of the total government spending on healthcare. $247 billion for Medicare and $226 billion for Medicaid, which means that covering the uninsured is only a small percentage of the total amount of healthcare. Savings due to healthcare reform. Individuals will save money because the cost of insurance premiums and taxes will come down. Money spent in healthcare insurance will not be taxed. Currently, all income is taxed on individuals whether health insurance is paid for or not. The Healthcare Reform Act and the Massachusetts Health Care Reform Act have several things in common. Mandatory health care coverage, universal coverage, same as Reform Act. Employee must offer coverage if more than 11 employees, regular private insurance. Employee must make a fair and responsible premium contribution or pay into Commonwealth Care Trust Fund an annual fair share employee contribution. Cannot go over $295 per employee. If employees are late in contributing, they will be required to pay 12% interest rate. Massachusetts response. The number of uninsured has been reduced greatly. Has not cost employer sponsored insurance to be reduced, which was one of the fears. Residents did not ignore requirements to purchase insurance as predicted. The number of insurance has doubled. Another way, a bankrupt state, but this is not the case. Costs have been kept within what was expected. It was also expected that the new law would be very unpopular, but most citizens say they support the law.